Remember to subscribe, and hit the bell icon, to never miss an update from Dr. Mike Baby Care Channel.
Your pregnancy. Week 35. At the 35-week mark, you're wrapping up month 8 of your pregnancy with 1 month left to go. Your little one may be starting to make an exit plan by shifting to the heads-down position, all while working on important preparations such as building body fat and brain matter. Your body is also in prep mode. You may feel some Braxton Hicks contractions as your uterine muscles practice for the big day. Your baby's development at 35 weeks. At 34 weeks, your baby is about the size of a spaghetti squash. By this week, almost all babies are positioned with their heads facing down toward your cervix, ready for their trip out. Your baby's arms and legs are growing chubbier, and her skin is becoming pink and smooth. She's getting ready for your cuddles. Amniotic fluid receding. By this time, your baby is floating in about a quart of amniotic fluid. It will now gradually decrease until you give birth. Your baby's lungs continue to develop and are producing surfactant. Surfactant is a substance that helps your baby's lungs function properly and be able to take in air when she's outside of your uterus. Her kidneys are fully developed now, and her liver can process some waste products. Most of her basic physical development is now complete. She'll spend the next few weeks putting on weight. 35 weeks pregnant symptoms. Along with other third trimester symptoms like Braxton Hicks contractions, fatigue, swelling, and frequent urination, you might also be experiencing some headaches and difficulties sleeping in these final weeks. You also have numbness in hands and feet. Sometimes swelling in your body presses on nerves and can cause numbness or tingling in your hands and feet. Don't hesitate to mention this to your healthcare provider if it bothers you often or causes pain. Wrist splints might help reduce the tingling in your hands. Resting in positions that take the pressure off your hands and feet, such as propping up your arms and legs on pillows, could help. The good news is that the numbness and tingling typically goes away after you give birth and the swelling subsides. Sore ribs. If your baby is head down and kicking her legs, you may have sore ribs. If this is because of your baby's position, the rib pain will ease as she moves down into your pelvis ready for birth. Your midwife will be able to tell you whether it's due to the position your baby is in. If the pain is severe and under your ribs, or you feel any heavy pressure on your chest, this could be a sign of preeclampsia, and you should call your midwife, doctor, or labor ward immediately. Clumsiness. You might feel clumsier than normal, which is perfectly understandable. Not only are you heavier, the concentration of weight in your pregnant belly causes a shift in your center of gravity. Plus, thanks to hormonal changes, your ligaments are more lax, so your joints are looser, which may also contribute to your balance being a bit off. Shortness of breath. It should improve after your baby moves further down into your pelvis, a process called lightening. Although lightening helps to relieve this symptom, it may also lead to increased frequency of urination as your baby adds increased pressure on your bladder. Expect that anytime in the next couple of weeks if this is your first baby. Pregnancy checklist at 35 weeks pregnant. Know about all your labor pain relief options, including local anesthesia and breathing techniques. Prep for postpartum care by stocking up on sanitary pads and other essentials. If you took a childbirth class, review your notes and practice your breathing techniques. Know all the stages of labor, learn about them so that you'll feel better prepared for labor and birth. Program important numbers into your phones. After delivery, things will not surprisingly be all about baby. So with just a few weeks left until full term, be sure to take some time for yourself. Cut yourself some slack and rest when you can. Now is the time to prioritize your well-being and start getting comfortable with incomplete projects and asking for help. Thank you for watching. Don't forget to subscribe.